Welcome, everybody, to Dr. Smith Live. It's our 72nd episode. God bless America. Tonight, we're going to be talking about everything you wanted to know about dementia that your family physician won't tell you. Anyway, little housekeeping. Next week, I invited Stanley Nye to come on with his fantastic repertoire of information on Qigong. Very powerful healing technique. And so that should be a really, really great show. The frequency shop is up and running. Jared told me the night that Monday he's going to have the instructional video on there before anyone actually purchases any of the plans to show you how easy it is to access the frequency programs. So that's coming down. The wine card is pretty amazing. Feedback has been phenomenal on that. And we're going to be rolling out our CBD oil. I've had some unbelievable feedback on that because it's so much more powerful than anything that's out there. And it's all purified with no toxins and other extraneous materials. So anyway, everything you wanted to know about dementia. We're going to be talking about what are the symptoms, causes of dementia, remedies for dementia and Alzheimer's disease, natural way of recovering from brain damage, why homocysteine is dangerous for your brain and factors contributing to high homocysteine levels, and supplements that can lower your homocysteine level. So a lot of really great information. The notes will be up tomorrow on two sites, ghsdoc.live. I think we have our fourth episode of The Cancer Deconstructed should be up. I think another week has slipped by. Anyway, a lot of great information for you that's practical, not just academic stuff. So the symptoms, dementia symptoms include impairment in thinking, communicating, and memory. Subtle short-term memory changes. Trouble with memory can be an early sign of dementia. The changes are often subtle and tend to involve short-term memory. So difficulty in finding the right words. Statin drugs can also cause dementia, people, and mess up your vocabulary. Depression, for instance, it's typical of early dementia. One typical type of personality change seen in dementia is a shift from being shy to outgoing, I guess like an alcoholic. Apathy or listlessness commonly occurs in early dementia. A person with symptoms could lose interest in hobbies or activities. Confusion, being repetitive. The sense of direction and spatial orientation commonly starts to deteriorate with the onset of dementia. So, causes for dementia. There's a possible connection between uncontrolled blood pressure and dementia. Important new studies link high blood pressure, especially in midlife, to an increased risk for dementia later in life. Atherosclerosis, that's clogging of the arteries. Research done by Matthias Rath, he was partnered up with Linus Pauling, the vitamin C guru. His formula is real simple. Vitamin C, proline, which is an amino acid, and lysine, which is an amino acid, will cleanse out your arteries. Also, clinician's preference, which has 11-to-1 ratio of omega-6 to omega-3, will clean out your blood vessels. Simple. You don't need fancy surgical procedures or invasive stents put in your heart and all that nonsense. Little note here, Alzheimer's disease disrupts both the way electrical charges travel within the cells and the activity of neurotransmitters. 100 billion nerve cells and 100 trillion connections can get disrupted from viruses, glyphosate, heavy metals, all kinds of toxins in our environment. Other causes, chemotherapy can cause chemo brain, and that'll cause dementia. destroys the neurons in your brain. Degeneration, well, chronic inflammation, all the processed foods and the chemicals that are in food and the air and the water. You got to clean your water, process it, because if you don't filter it, your brain and your organs will. Statin drugs, they'll lower your cholesterol, preventing your brain from repairing itself and actually shrink your brain. Plus, it causes rhabdomyolysis, which is breakdown of muscle tissue, type 2 diabetes, okay? And liver and kidney damage. Other than that, it's a wonderful drug. The cortex will shrivel up, damaging areas involved in thinking, planning, and remembering, all from statin drugs. Shrinkage especially is severe in the hippocampus part of the brain, which is the area of the cortex that plays a key role in the formation of new memories and behavioral center. So buyer beware, stay away from drugs. Plaques, the beta amyloid, abnormal sticky clusters of protein fragments build up between the nerve cells. The beta amyloid comes from a larger protein found in the fatty membrane surrounding your nerve cells. A protein called tau, T-A-U, helps the tracks stay straight of your protein. Tau collapses into twisted strands called tangles. Nutrients and other essential supplements can no longer move through the cells, which eventually die, and you got the dementia problems. Remedies for dementia and Alzheimer's disease. Dr. Miles Fielding recommended coconut oil. Research from Brown University regulates glucose, the coconut oil does, results in brain atrophy, insulin resistance. Ketones from MCT stimulates growth of new brain cells. So coconut oil is also high in vitamin E. It can sit on your countertop for 5 years without going rancid because it's loaded with vitamin E. It actually tastes good too. Ketones are energy-producing molecules made from fats. Our bodies can make the ketones from stored fat or from special fats known as medium-chain triglycerides, or MCTs, found in coconut oil. So ketones are produced specifically by the body to feed the brain. Ketones not only supply a superior source of energy to the brain, but trigger the activation of specialized proteins called brain-derived neurotrophic factors that function in brain cell maintenance, repair, and protection. They also stimulate the growth of new brain cells to take the place of the dead or dying cells. This allows healing and repair to take place. Ketones are ordinarily produced when blood glucose levels become low. Since glucose is the body's primary source of energy, when glucose levels fall, the body starts mobilizing stored fat to produce ketones to maintain adequate energy levels. The medium chain triglycerides, or MCTs, are very important for proper functioning of your neurotransmitters in the brain, and coconut oil is full of them. One particular thing I found out about MCTs is that they work synergistically with omega-3 fatty acids, liberating them from fat stores in the body and allowing them to be utilized by the brain more efficiently. Coconut oil has high amounts of medium-chain triglycerides. It is also rich in lauric acid and caprylic acid. Coconut oil reduces oxidative stress. It has powerful antifungal, antiviral, antimicrobial, and antiparasitic activity. It supports the immune system, is thyroid stimulating, controls blood sugar, improves cognition, repairs damaged tissues, and supports healthy digestion. Coconut oil nourishes the brain. It helps with brain function, the repair and protection of the brain, facilitating proper functioning of neurotransmitters, and more. Turmeric, great spice. It's good for your skin, give you that younger looking look, but it's also anti-inflammatory, and it helps the liver to detoxify poisons that it pulls out of the blood. Ginkgo biloba, wonderful for short-term memory, increases the blood flow in your brain. Bacopa is great for long-term memory. Butter, grass-fed. Curry butter, I always use. It's from Ireland. It's phenomenal. You need fat, people. There's a whole myth about not eating fats. Good quality fats your body needs for repair. GABA, gamma aminobutyric acid, animal-based omega-3 fats, which vegetarians are not getting a whole lot of. Flax oil has it in there. Vitamin D3, very, very important. Unfortunately, a lot of people are low in it. DHA consumption reduced Alzheimer's risk by about 50%. Lowering homocysteine by giving appropriate supplemental levels of homocysteine-lowering nutrients, including B6, B12, and folic acid, will help reduce your risks of dementia. Ketones help repair the brain of dementia and Alzheimer's disease. Growth and differentiating factor 10 is a key player in repairing mechanisms following stroke. GDF, which is your growth differentiating factor, stimulates axonal sprouting, which is activated as the brain attempts to overcome the damage. The natural way of recovering from brain damage. The brain repairs itself naturally in 3 ways. 1, collateral sprouting. 2, substitution of function. And 3, neurogenesis. Collateral sprouting happens when axons grow new branches to compensate with adjacent damaged and non-functional neurons. So you picture a spider fixing a hole in its web, and that's what collateral sprouting is all about. Substitution of function happens when the function of the damaged area of the brain over by another area, it's picked up by another area of the brain. Neurogenesis happens when new neurons are generated in the brain. Gould and others in 1999 documented thousands of new growing neurons in monkey brains. So years ago, medicine thought once your neurons die, you don't replace them. Unfortunately, that's old wives' tale and myths amongst medicine. Demential statistics, 21 million to 53 million are going to be present by the year 2053. A lot of brain dead people. People with Alzheimer's live an average of 8 years, but some people may even survive for 20 years in La La Land. A diet high in fat, we're talking like 60 to 7% of calories, is almost by definition low in carbs. And this means when eating a high-fat diet, it's likely that one is at least partially and some of the time in a state of ketosis. Interestingly, mother's milk has no carbohydrates in it. It's kind of telling you something. It's high in fat and protein. So, for those of you who don't know, ketosis is what is called when the body switches over from burning glucose, which is a kind of sugar that our body uses for fuel, to burning an alternative fuel called ketones, which are made from the breakdown of fatty acids in the liver when glycogen, and that's how our body stores the glucose in the form of glycogen, when those levels are depleted. Ketogenic diets also upregulate mitochondrial biogenesis. Mitochondria are a little like Idaho potatoes in your cells, and your brain has a lot of them, your heart has a lot of them, because they create ATP and energy for your cells to work. So the process by which new mitochondria are formed inside the cells is called biogenesis. So we have a more efficient fuel producing more energy and stimulating the growth of even more fuel engines, the mitochondria. Unfortunately, when mitochondria become polluted with heavy metals, candida, chemicals, glyphosate, other poisons, PCBs, the main symptom that you experience is fatigue. Anytime people have chronic fatigue, invariably their mitochondria are polluted. So no wonder people report the effect of a high-fat diet being like the lights were turned on. I've had people who had mercury toxicity, and when we clean up the mercury, they say their colors become more vivid, their vision becomes more clear and brighter. So these are clinical observations that my patients have told me. So the increase in formation of mitochondria, especially beneficial when we take into account that mitochondrial damage and energy production failure are central components of many neurological disorders. Again, it's all pollutants from our environment, processed foods, chemtrails, radiation from Fukushima, you name it. Other interesting components is glutamate toxicity can lead to neuronal injury and even neuronal death by creating free radicals and inhibiting mitochondrial function. As foods ripen, the levels of free glutamate increase, resulting in a richer, more flavorful taste. This is why foods naturally high in glutamate, when ripe or mature, such as tomatoes, cheese, and mushrooms, are used to enhance the taste and balance of savory recipes. Now, food sources for glutamate: soy sauce has 1,264 milligrams per 100 grams of soy sauce. Parmesan cheese has 1,680 milligrams per 100 grams of food. Roquefort cheese, 1,280 milligrams per 100 grams of food. Fish sauces, 1,383 milligrams per 100 grams. Walnuts have 658 milligrams per 100 grams. And cured ham has 337 milligrams per 100 grams. So even though it's a food source, it still damages the neurons in your brain. Docosahexaenoic acid, or DHA, it's an omega-3 fat, is an essential structural component of both your brain and the retina. Approximately 60% of your brain is composed of fats, 25% of which is DHA. DHA is also an essential structural ingredient of breast milk. Interestingly, when you take parent essential oils that Brian S. Peskin advocates, and if you want to read his book, I advocate it, PEO Solution, your body can make DHA, EPA, and any omega oils that it needs. Most of the essential fatty acids that are sold in health food stores, unfortunately, are derivatives, and they cannot produce DHA or EPA. And most of the physicians are advocating fish oils, which is rancid at room temperature and toxic. So say no to fish oil and get some good omega-3 fatty acids and omega-6, which are actually more important than the omega-3. 25% of your brain is, which is DHA. DHA is also an essential structural ingredient, like I said, in breast milk. DHA levels have been linked to memory loss and Alzheimer's disease. I also find clinically with Alzheimer's and other neurological problems, pesticides, insecticides, and herbicides in the brain. Activated vitamin D3 receptors increase nerve growth in your brain. And researchers have also located metabolic pathways for vitamin D3 in the hippocampus and cerebellum, which focuses on muscle balance in your body of the brain. Areas that are involved in planning, processing of information, and the formation of new memories. So very, very important, vitamin D3. It's a hormone. It's not really a vitamin. The National Institutes of Mental Health recently concluded that it is vital that the mother get enough vitamin D3 while pregnant in order for the baby's brain to develop properly. The child must also get enough vitamin D3 after birth for normal brain functioning. In older adults, too, research has shown that low vitamin D3 levels are associated with poor brain function, and increasing levels may help keep older adults mentally fit. Appropriate sun exposure would take care of these issues, as the sun is irreplaceable when it comes to the body's ability to produce adequate amounts of vitamin D3. Now, in the notes, there's a picture of the United States. Those states that are above the 48th parallel, unfortunately, when the sun is shining, you're not getting enough exposure to produce adequate amounts of vitamin D. So unfortunately, Pennsylvania is above the 40-degree parallel. Ohio is above. Half of Indiana is above. Iowa and Nebraska above. And New Jersey, of course, is above. So the key is Kentucky, Virginia, West Virginia, North Carolina, Tennessee, Arkansas, or below 40th. So don't think for a minute that if you take your shirt off and you're sunbathing in your backyard, you're getting enough sunshine for vitamin D3. It's not going to happen, people. Appropriate sun exposure is all it takes to keep your levels where they need to be for healthy brain function if you're below the 40th degree parallel. It is not an option. A safe tanning bed is the next best alternative, followed by vitamin D3 supplementation. It now appears as though most adults need 8,000 international units of D3 a day in order to get their serum levels above 40 nanograms per milliliter, which is the lowest they should be. Ideally, your serum levels should be between 50 and 70 nanograms per milliliter and up to 100 nanograms per milliliter to treat cancer and heart disease. However, it's important to realize that there's no magic dosage when it comes to vitamin D3. What's important is your serum level. So you need to get your vitamin D3 levels tested to make sure that you're staying within the optimal therapeutic ranges as indicated below. And I have a little chart that you can see when you look at the notes. If you're below 50 nanograms per milliliter, you are deficient, people. Optimal level, 50 to 70 nanograms per milliliter. Treatment of cancer and heart disease between 70 and 100 nanograms per milliliter. Excess is greater than 100 nanograms per milliliter. So that's the key. Now, homocysteine reduction. Homocysteine is an amino acid made from a common dietary amino acid, methionine, that inflicts damage to the inner arterial lining, your endothelium, which is the name of your inner arterial lining, and it contributes to many diseases. We're talking cardiovascular disease, congestive heart failure, stroke, migraines, age-related macular degeneration, hearing loss, brain atrophy, and Alzheimer's disease. Fortunately, B vitamins like folate, vitamins B6 and B12, and other integrative interventions can reduce homocysteine and counteract this destructive process. Causes of high homocysteine levels, or basically many factors contribute to high homocysteine levels. Insufficient folate in your diet. They come from greens. B6, B12, betaine, vitamin B2, and magnesium. Prescription drug use, including cholesterol-tyramine, cholesterol, fenofibrate, levodopa, metformin, which is, I believe, for diabetes, methotrexate for cancer, niacin, nitrous oxide, and phentoin, and sulfalazine. High methionine diets, including red meat and dairy products, can lower or increase your homocysteine levels. Smoking, coffee, alcohol consumption, advancing age, obesity, genetic variants that cause an impaired ability to metabolize active folate from folic acid. Note, Life Extension believes that the optimal range of homocysteine levels should be less than 7 to 8 micromoles per liter, much lower than the current medical establishment, which accepts 15 micromoles per liter. So as usual, a lot of disinformation is being disseminated by our medical mafia. Dietary and lifestyle changes. Several dietary and lifestyle changes can help reduce your chronic inflammation. Avoid methionine-rich foods like red meat and dairy products. Exercise, as patients in a cardiac rehabilitation program showed a reduction in homocysteine from exercise alone. And decrease or eliminate alcohol and smoking, or in moderation. Integrative interventions, B vitamins, folate, along with vitamins B6 and B12, have been shown in numerous studies to help lower homocysteine levels. The active form of folate is L-methylfolate, can achieve plasma folate levels up to 700% higher than synthetic folic acid, and therefore may be more effective at lowering homocysteine levels. Your one-a-day gummy bear supplements are all synthetic, and it's garbage. You're not going to get your folic acid levels. Betaine, which is trimethylglycine, and choline, which actually converts to trimethylglycine. So higher intakes of trimethylglycine and choline, which is actually converted to trimethylglycine in the body, are related to lower circulating homocysteine. Homocysteine can also damage your heart big time. N-acetyl L-cysteine, they call it NAC, NAC. NAC may displace homocysteine from its protein carrier, which lowers homocysteine and promotes the formation of cysteine and glutathione, which is a powerful antioxidant. And especially those people who had COVID or have COVID, the NAC helps the glutathione levels to be maintained at a higher level, and you'll get rid of your COVID symptoms much more quickly. Adenylyl methionine, or SAMe, supplementing with SAMe promotes the conversion of homocysteine to cysteine, which is then converted to glutathione and lowers homocysteine levels. Taurine. Research suggests taurine can block methionine absorption and produce a significant decline in homocysteine levels in 4 weeks. So the key is taurine is very beneficial, and that should also be in your cat and dog food, because lack of taurine, cats that develop heart problems. Also, tremendous help is, interestingly, infrared light through the ears can stimulate neurogenesis of brain neurons. There's university studies showing that infrared light coming through the ears will stimulate neuron repair. So that is my presentation tonight. Dementia is a big, big problem in our society because of the toxic bowel, the processed foods, toxic water, chemtrails, and the radiation that we're all getting from Fukushima. So, Jared, we must have some questions. If you had a type of dermatitis on the skin or sensitive area, what you would do to get the skin back to normal? Topically and internal. Basically, internal. Your skin is the second most excretory gland, biggest excretory gland of the body. So whatever shows up on the skin is a manifestation of what's going on inside the body. The clinician's preference, I use it all the time myself and with my patients, omega-6. Omega-6 oils are 1,000-to-1 ratio of omega-6 to omega-3 in your skin. So it's very, very important to get organic cold-pressed omega-6 oils in your diet. Most of the oils that you get at the supermarkets and the stores, they're adulterated, and it's messing up your skin. Also, cleaning up the liver, very big, important aspect, because whatever toxins that are not being disposed of through your liver and the bile in your intestines are going to come out through the skin. So the name of the game is clean up your diet, get good fresh juices, and the oils are one of the most important things. When you put topical chemicals on your skin, it's like painting on rust. It may look good temporarily, but it's not getting to the root cause of the problem. Stephanie, good question. Thank you. Electron recycler. Any idea what to do with the epithelial membrane of the eye? Well, vitamin C, food-based, very important for the eyes, especially Cyruta Plus, which is made from green buckwheat, literally helps repair the cell membranes. The omega-6 oils are extremely important. The eye has a very high concentration of glutathione, very, very important. Also, hot pepper, cayenne, helps increase circulation of all the blood vessels in the body. So the key in the retina, the epiretinal membrane, again, you need vitamin E, you need vitamin A, you need vitamin C, and glutathione, the omega-6 oils, and that should help repair the eyeballs. What is your opinion on surgery for cavitations? They do a bone density test, and if it's higher than negative number of a minus VE 100, then a candidate for surgery. Must take a cone beam x-ray to show the bone density numbers. Well, my professional opinion on surgery cavitations is that you really have to clean up the body, the liver, the lymphatics, the kidneys. Invariably, 4.5 months after they do cavitations, the infections come back. Why? Because they're surgerizing in a toxic environment in the bone. They're not cleaning up the problem. And so with virtual injections, with ozone injections into the bone, with right frequencies into the bone, with our biophoton pen, we can enhance the terrain of the bone before they do any cavitational surgery. And you also want to, up your nutritional intake, such as pure synergy, good dark green leafy vegetables, fresh juices, carrot, beet, celery. Because if your body doesn't have the right raw materials, it can't heal properly. And it's lunacy to think that doing a surgical procedure is going to remove every last virus or bacteria in that area. And if you don't have a healthy thyroid to boost your immune system or thymus gland and a good filter, your liver, these infections are going to come back. It's a joke. I mean, I prepare my patients before, years ago when I used to do mercury removal, would put them on a nutritional program for at least a minimum of 2 weeks before start the removal and make sure that their thyroid is working. You can do energy testing to determine the toxicity in the jawbone. A cone beam is a very good diagnostic system, but the key is energetically you can test to see what toxins are in the jawbone and what pathogens are in the jawbone. So the older I get, the more conservative I get. Does having a low lymphocyte count mean a higher tendency for cancer? What do you recommend to do increase lymphocyte numbers? Well, anytime you have low lymphocytes, your immune system is weak from the get-go. Again, your essential oils, furrow food that help your bone marrow, Bios, which is also a blueprint for repairing the bone to get your lymphocyte levels. Wheat germ oil helps supply vitamin T. So the key is pure synergy supplies the body with all the raw materials to help repair the bone, help improve the blood. You need vitamin C, the essential oils. Anytime you have low immune system cells, like lymphocytes or phagocytes, you're nutritionally deficient. So the key in the equation is you got to start putting Sunoco racing fuel in your body, like good amino acids. I mean, I just started to take a good collagen product to help give me the good amino acids. And again, it all helps to boost your immune system. Platinum Plus helps boost your immune system. And you'll see after, 3 months of eating clean and taking good nutrients, if you do take your blood, get it evaluated again, your lymphocyte levels will come up. Your channel should be their most popular YouTube channel with your knowledge. Thank you. I have X-linked hypophosphatemia, rickets, a rare degenerative genetic disease. Key in the equation, what's in the bone producing the marrow to function properly? I honestly believe that genetic, quote, disease or dysfunction is caused by some toxin, whether it be a childhood vaccine, mercury or thimerosal, glyphosate, insecticide, or pesticide. Something's hooked onto the DNA in the bone marrow, causing it not to work properly. With our new biophoton pen, I believe we can help correct the DNA in the area, and it's with frequencies. So again, I always say, what are the splinters? What are the initiators in the area where the bone is not functioning properly? I mean, I had a young boy about 4.5 years ago with cancer of the bone and the muscle tissue, osteosarcoma. And he was in pain, constant pain when he came to me. And one of the splinters that were in his bone where the cancer was glyphosate. And just putting him on, well, first just defining the cause of his pain and the cancer, and putting him on isopathic phenolic rings. In 6 weeks, he was totally out of pain. He also had mercury, cytomegalovirus, cadmium, and aluminum in the bone and the muscles. And when I got rid of those initiators, guess what? His osteosarcoma, the cancer, disappeared. And it's been 3.5 years. And he's in remission. You have to define what's causing the problem. And I don't care if it's in your brain, if it's in your thyroid, if it's in your bone marrow, if it's in your liver, you have to define what's causing that problem. And the docs are not doing it. They'll just run a blood test. Oh, you'll have too low of phosphorus in your blood, or too much ferritin in your blood, or you have alkaline phosphatase elevated levels. But they don't know what the hell's causing it, because they don't have the skill level or the knowledge to know what to even look for. So always look for the underlying causes. What's causing the problem? Good question, Jessica. Sound therapy. Very, very beneficial, Gregory, if you get the right frequency. So each sound has different frequencies. You can listen to it on YouTube. It can help mental, emotional issues and help detox the body. So the key in the equation is you're better off listening to classical music that have good quality frequencies than this rap crap that's out there, because that's going to deteriorate your health. Do you recommend to have all metals removed from the mouth, that is gold crowns, to replace them with zirconia? No, zirconia, I have it in my own mouth, zirconia. It's very safe, even though it's a crystal and it is a metallic substance. You got to be careful when you start, mercury fillings, no doubt about it, leak 24/7. Well, if you increase the alkalinity of your saliva, you're going to decrease the amount of mercury that's coming out of your fillings. The thing you have to weigh is very, very important. Number one, okay? If you have a large mercury filling and you cut it out, there's a strong possibility that the nerve can die and set you up for a root canal, which to me is worse than the metal being in the tooth, because you can counteract it with chelating agents like glutathione, for example. Gold crowns, again, if it's a good quality gold, it can be fine. When you have mixed metals in the mouth, you get galvanic currents, and that can create an issue. But the other big problem is when they start replacing the mercury fillings or gold crowns, they do not have the skills to balance your cranial mechanism with your bite. And that can send you in one hell of a tailspin, trust me, because I see the patients that have been in pain for 25 years, 5 years, want to commit suicide because the pain's so great. So not most of the dentists don't have a clue about the bite and cranial balance. And that's frightening people, but that's the God's honest truth. So you really have to be careful. I'd rather have the metal in my mouth and take antioxidants to counteract it and eat an alkaline diet than start getting them ripped out, and then now you're in the slippery slope. Word to the wise. Are you a fan of cell salts? Absolutely. Again, you'll have to test the cell salts to see the best ones that are compatible with your body. I'm not a fan of just standard protocol shotgunning people with a bunch of stuff. Cell salts definitely work really, really well when you get the right ones. Okay. Veronica, how are you? Recommendations for essential thrombocytopenia. Okay, too many platelets. Get a pet leech. No, I'm only kidding you. Again, interesting. Like I had a patient who had polycythemia vera. He would go every 3 weeks to Jefferson to bleed him. And it turned out he had mercury toxicity from all his fillings. When I took out all his mercury fillings, that was probably 25 years ago, his blood problem totally cleared up. So thrombocytopenia, I have to believe, is going to be a reaction to something that's stimulating overproduction of platelets, some toxin in your mouth or some chemical in your body. Like I said, dioxin, PCBs, childhood vaccines trapped in maybe the bone marrow. These are issues that most healthcare practitioners are not looking for. So drugs could be trapped in your bone marrow. I mean, I just had a patient like 3 weeks ago. He has heart problems, and he had Cipro and Levaquin trapped in his heart from 3-4 years ago. So there could be so many variables, and you just have to test, and you can do it verbally. You don't need the actual substance. So again, always think of splinters. Okay, do you think zirconia is a good crown, but how can we still use a dead tooth bone to stimulate bone? Basically, the body repairs itself. Bone takes a little bit longer than other tissues, but again, you have to supply the raw materials, the protomorphogens, like BIOS from Standard Process, which provides the genetic blueprint to repair the bone. So you have to take the right nutrients to stimulate the genetic ability of the bone and give it the right raw nutrients. So zirconia is a good material. It's strong. It's lighter than gold. Gold is very dense, and that can affect the weight of your head on your neck, believe it or not. See, the dentists don't equate this issue because they're not taught this information. So you put a 3-unit gold bridge in your mouth, that increases the weight of your head, and your muscles are going to be overworking to try to maintain balance. So zirconia is definitely the closest thing to what natural teeth will feel like. Again, the bone pure synergy is probably one of the best raw materials, 60 different organic and well-crafted grasses and herbs and vitamins to help repair the bone. And also defining what splinters or initiators are in the bone causing the problem. On your ICNR website, I saw to aim 30 hertz frequencies at your head for blindness, at your chest for heart attack. How would I aim it? Well, basically, you really don't have to aim it. If you had cylinders in your hand, you could put one in front of your heart, one behind it. But to be honest with you, if you're holding the cylinders in your hand, the body's 70 to 80% fluid. the frequencies are going to go from your head to your feet in nanoseconds. Every cell's going to get it. So you really don't have to aim it. So that's what I recommend. And the same thing with light. When you use light exposure to the body, the tubulin in the nerve tracts transmits the light in nanoseconds throughout your whole body. It's that efficient. Okay. I like rice and use soy sauce. God bless you. I heard soy is bad for men. It's bad for everybody. Soy suppresses thyroid, and if you don't have enough T4 or T3, you're not going to convert to the testosterone. And you need testosterone. Soy is going to suppress thyroid function, and it's high in glutamate, which is going to destroy neurons in your brain. What can I tell you? I would try to avoid it, at all costs. And get good basmati rice, good short grain brown rice. But stay away from soy sauce. Again, it suppresses thyroid function, and that dictates the function of every cell of your body. And it also has to do with thyroid and testosterone levels. Okay, was it? What's your go-to toothpaste and mouth routine? Natural mouthwash. I developed my own toothpaste, Aqua Essence. It has all kinds of essential oils in there and vitamins, antioxidants. The feedback has been phenomenal on it. As far as a mouth routine, I like a water irrigating device, and I put magnesium iodine in the reservoir at night. So when I flush out my mouth, the iodine helps keep the bacterial content reduced. I mean, you can use baking soda and peroxide and help reduce the bacterial content. So also gum and tooth tonic is rated one of the best in the country. It's all herbal, no alcohol, very, very concentrated. All you need is, like maybe 4 or 5 drops in a cup of water. So gum and tooth tonic, and my toothpaste and baking soda and peroxide. So you don't have to go crazy. And you can do oil pulling with coconut oil or sesame oil. So key is keep it alkaline and stay away from the junk foods. In India, we're used to activate charcoal. Also, you have essential oil that's very good. Neem oil and neem powder for brushing with the teeth, which is very, very good. But yeah, charcoal absorbs all kinds of toxins. And again, neem powder, neem oil. In fact, they would take twigs and they would separate the twigs to get little strands and use that to brush their teeth. But they usually in India have pretty good quality food there. Do we run out of questions? Anyway, thank you so much for taking time out of your busy schedule to listen. Like I said, tomorrow the notes will be up on, I think, ICNR and also ghsdoc.live. Have a fantastic link to Judy Mikovits on vaccines. The information that she tells you, and it's on my website, so please share that with your friends. These poisons that are in the vaccines have been there for 20 years, according to Judy Mikovits. It's nothing new. Do you sell the toothpaste on your site? Yes, Aqua Essence Toothpaste, I think, .com. It's also on ICNR, I believe. It should be there. But yeah, it's very good tasting. It's full of, and we also have one formula with colloidal silver in it too. If you have bleeding gums, you want to use the colloidal silver formula. If not, it's a little bit less money. You don't have to use the colloidal silver. But you'll see your mouth, after a while, the bleeding stops, and it's just very refreshing. Are headphones okay to use for frequencies while you sleep? Unfortunately, the frequencies are going to fry your brain, the electromagnetic frequencies from the headphones. So I would try to avoid it. Let me tell you something. That's an interesting question. In the year 2000, I put on a seminar in Antigua, in the Caribbean. Interestingly, one of the couples had a son. He was 2 years old, Justin. And he always woke up irritable and miserable every morning for 2 years. There was a dentist from Germany that was at the seminar, and he had this Mobilis loop. It's kind of like an Omega loop, a coil of copper. And my son had a CD player. So they played the frequency, they played Mozart while the kid was sleeping. Now, he couldn't hear the sound because the sounds were being disseminated through the Mobilis loop. So the frequencies were coming off of this Mobilis loop into the room where he was sleeping. Well, the next day when he got up, the parents said it was the first time in 2 years that he woke up happy. So you don't have to listen to the actual frequency. You can broadcast them into your room through a copper loop that's plugged into your player. You don't have to hear it, but it affects you. So great question. But yeah, the headphones will fry your brains. What's your take on the monkeypox? Well, as Judy Mikovits said, the monkeypox has been in the vaccines for like 20 years. And of course, they're going to do a number and scare the living pants off of people again, they want to get mail-in ballots for the 22 midterms. But yeah, you're not going to die from it. What's your take on the monkey? Okay, is that it? Anyway, next week we should have a great program with Stanley. He has an incredible repertoire of knowledge, and he always ceases to amaze me. Thank you again. God bless you, and see you next week.